Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Good evening. Thanks everyone for joining us today. And thank you, April, being the co-host. Thank you. April, we have to talk about this issue of a shortage of teachers. You're hearing it all over, especially over County. I guess that's the grassroots concern of ours, but it's a national crisis, I believe. I think it's crisis proportion now, I would call it. What do you think?
It's definitely a national crisis, and I'm sure there's several reasons why it's happening. So, it's great that we have a wonderful guest tonight who can kind of give us her thoughts on what could be causing this teacher shortage, but also what people who are interested in education can do if they want to become teachers. And so it's going to be some really good information tonight on that topic.
Yeah, and hopefully then we can have our audience will really get a hold of this and digest it, and especially those who are seeking, employment in the educational field, knowing that such things exist like that, and I'm sure they're aware of it. You know, if you're a college graduate in any place and you hear about the teacher shortage, and I don't know why there's a lot of graduates not seeking teaching positions, and especially in high schools and stuff like that. I don't know. So, but we're going to dwell on that this evening and find out. We can get some information from our guests, and later on after that, we're going to talk a little bit about our health care. What not just opportunities there, but what's going on that maybe a lot of people in the community are not aware of that can contribute to the preventive care. Okay. And these things happen. So you just the information doesn't get out there as appropriately as one would like. So, and sometimes it's hard to reach certain communities. And that's why I guess it's so good to have a guest on there like that. And that's coming up after we talk about our teacher shortages. So let's get with our guest there, April. And you can how are you doing, Miss Carter? Can you hear us?
Can you hear us now? Etta, can you hear us?
Oh.
Let's see. I know she was saying a few minutes ago she couldn't hear us. Let's see what happens. Can you hear us now, Etta? Okay, we can see you're on the screen live. Can you hear us? Okay. I'm going to take her off the screen for a moment and ask her to go out and come back in. Okay. All right.
We'll get there. We'll get there.
Yeah.
Okay.
Well, let's get back to the topic that you were talking about a few moments ago, what you said about, why aren't more people going into education, becoming teachers and that type of thing? There probably could be a lot of things attributed to that, Brother Edward. There's a lot of dialogue about, the challenges teachers have in education right now. The fact that, number one, they're, definitely underpaid. And so that
always leads the reasons for people not going into education, so many other alternatives.
Yeah, it does take away the attractiveness of, that career field. But, I think that when you think about the type of people who enter the education arena, that might be one way to make sure that you're not getting someone who is just in it for the pay, because it takes a lot to be a teacher. It takes a special person to be an educator. and to take on the responsibility of growing someone's mind and their their thought processes and what they value in society and in life. And so, not that, being underpaid in any system is a way to weed people out, but it naturally weeds certain people out. There are people who are going into the profession
Right.
who, are doing it because they have a passion for education and they're willing to do whatever it takes.
That's
and
true.
there are people who are staying in the profession because they have a passion for education and they're willing to do what it takes.
Right.
But that still doesn't make it right when it comes down to the fact that, our teacher shortage is underpinned by a lot of different, challenges that most teachers are facing right now. I mean, if you're underpaid, you have a shortage of supplies, you have a shortage of resources. There are learning disparities that happen, and teachers almost have to play, catch up while they're still going forward. There's just a lot. It's a lot to balance. There's a lot to balance.
It is.
So
it is.
yes. So as people do their research about career fields and occupations that they may want to go into, it makes it harder for education systems to recruit the right people for the right reasons. But, even like I said before, even if people thought that, oh, wow, this is, it's glamorous and it's definitely something that I want to do. And now I don't want to do it because, I'm short of pay. All of it turns into the thought that, a teacher shortage means that we are always going to have shortages of some sort in the classroom. And so, hopefully school systems are really paying attention to what's happening and they're understanding, or at least developing an understanding of why people are not entering the education field as robustly as they used to, so that, they can figure out how to make the teaching profession more alluring and, to maybe come up with some benefits and things that will make people want to come into the profession and feel appreciated and like, their work is valued. So I don't know, it's really interesting. And again, it takes a lot to be an educator. It takes a lot to be a teacher. So we're going to bring on Etta. Hopefully Etta has her sound. Hello, Etta.
Hello.
Oh, yes, we have. Yay. Awesome. Yeah. And so Etta, welcome. Yeah. Oh, we're great. How are you doing this evening?
Great. Glad to be here.
All right. So you had a great day in education, I'm sure, today.
Oh, yes. I'm still here.
Exactly. You're still in your second home. You're home away from home. For those people who do not know who you are, Etta, please introduce yourself to our listening and viewing audience.
Sure. My name is Etta Greene Carter. I am Horry County Schools Adult Education Director.
Award-winning adult education director. Thank you, April. You're welcome.
This is my 10th year at adult education and my 25th in education.
Woo! So I don't know if you heard the conversation between Brother Edward and I a few minutes ago. We were talking about how it takes a special person to stay in education and to get into education, especially with the challenges that you all face these days. So yeah, what is going on in the world of education? Tell us a little bit about your world.
The world of education, we are thriving and trying to do what's right for kids, making, there is a teacher shortage, but there's a teacher shortage all across the nation. But we are definitely working to help kids close the gaps from the pandemic, and working to see what we can do to make sure that we produce world-class citizens out of Horry County schools.
Mm-hmm. Absolutely. So, one of the things that we were talking about is, a part of this teacher shortage discussion is rooted in some of the things that teachers believe need to be made better, in the education system. Lack of resources is one thing, lack of pay or low pay. And so, Etta, as you think about those challenges that the education system faces when trying to recruit teachers, what do you think are some of the solutions? And, do you think it'll ever change?
I think that some of the solutions are to make sure that teachers have what they need and actually pay them what they're worth. Horry County has done a lot to try to compete and keep teachers. They did a salary study a couple of years ago, and there was some raises given to teachers and support staff because there's a shortage all the way across the board, just people working everywhere. But they've done those kinds of things. And in Horry County, now I can't speak for other counties, but I know in Horry County, when it comes to resources, we have resources galore. And in some cases, it might be too many resources, but we have resources galore. I think that a part of what we're seeing is just a change in the times. You know, one time being a teacher was an esteemed role, and for a lot of people, still is an esteemed role. But sometimes teachers get a hard time from the community and from parents when they really have students' best interests at heart. And media doesn't really help the situation because there's so many great things that go on in schools and so many great teachers, but the things that get highlighted are usually the things that are not very positive. So lots of teachers people who might want to change their career and become a teacher may think twice. But I invite everybody to try teaching. If you think you may have a passion for it, we definitely need teachers. The salary is competitive in Horry County. I can't speak across the board, but in Horry County, it is competitive because they've really done a lot of work. There's some sign-on bonuses for some of those most in need areas. So I think that, first of all, you know, the times are changing. So the research says that young people want to change careers 5 times. Whereas
Really?
it used to be that, you know, you became a teacher, you stayed a teacher for a lifetime. But the research says these young people who are coming out of college, they're going to change careers 5 times. So that doesn't help with the recruiting and keeping teachers. A long term, the first 5 years is critical for most teachers. And Horry County has done some stuff like put some teacher support specialists in place to help teachers who are coming in. And we have curriculum specialists and people who can add support to new teachers coming into the profession. But it's just a different time.
It is.
A lot of people are retiring. So
maybe that's a pool. That's a pool that you should probably consider.
Oh yes.
Tapping into. Yeah.
Right. So the retired teachers, a lot of retired teachers have come back to teaching because there are incentives at the state level because they know that we need teachers. So you can retire and draw your retirement and actually come back and teach and get full salary.
That's a pretty good incentive.
Yeah, that's a great.
That's an excellent incentive. Get 2 checks.
When you think about those folks, you know, then they're already seasoned. They know what they're doing.
Absolutely.
They don't need as much support. So those are some of the creative things they've done to try to attract teachers. I know we also have a program, I think it's called Grow From Within. And that program is for somebody who's working full-time in Horry County schools who would like to become a teacher, may have an associate's degree or may have a 4-year degree. There's some assistance to help them. There's some incentives with Coastal Carolina where we can take classes at a reduced rate. So they're doing some things, but sometimes you just don't know what the answer is. You keep trying different things to try to attract the right people because we definitely want the right people in the classroom with the young people because we're at a critical time with our young people because they're needing guidance and sometimes they get guidance from places they shouldn't.
Yeah. Well.
That's very true. So, Etta, you were talking about how times have changed and COVID has certainly done its share of damage when it comes down to the impact on education. And so as you came back from COVID and the students that attend Horry County Adult Ed came back from COVID, what was like the main thing that they had to contend with as far as adjusting and coming back to an in-person school setting, since everyone was, 2 years doing everything virtually?
Right. I think that people were grappling with fear. And some people were so isolated during that time period that it took a while for them to come back. So like in adult education, we are just seeing our numbers come back to pre-COVID numbers because people were fearful to come back out of the unknown. Some people, really, their mental health is huge through the COVID piece, because we don't realize how important that socialization piece is, and people have been isolated. So that's a part of it. And then a lot of people during COVID had found different ways to make a living. So because they found different ways to make a living, they didn't come back as quickly as we would have hoped. But now we have students back to pre-pandemic numbers. And if our start of the school year is any indication, we will surpass our pre-COVID numbers this year. Now, of course, COVID is not gone.
No,
so,
it's not.
We still have
cousin that come.
Yeah, we still have masks and things of that nature available for students who would like to have it. It's not enforced, but definitely available to them. So we've seen the student numbers come back, but a lot of teachers retired during COVID because they have underlying health conditions, and just like when a baby goes to preschool, and they're used to that one environment at home. When they go to preschool, they start having colds and things of that nature as they adjust. So people have made the sacrifice to go home to make sure that they kept their health intact.
Well, I know that you have some information for us tonight about what people can do who want to go into education, need to do, how they can get started. So what are some of the great things that are offered to help someone start a career in education?
Okay, so for those who already have a college degree, there are alternative certification programs that that people can participate in. One of them is offered through the State Department, and we call it PACE. Teachers of Tomorrow is another, and then American Board is another one. American Academy, I think it is the other one that Horry County accepts. So with those programs, the first step would be to send in your transcript from your college to the State Department's certification department. They will review it for you, and they will come back and tell you the things that you could possibly be certified in to teach. So if your background is business, you might end up with business education. If your background is sociology or psychology, you might end up with special education or science, or social studies. But they will tell you what you could be certified in, and then what the process is, whether you have to take additional classes, what tests you have to take to prepare to meet the requirements to come and teach. The great thing about it is that while you are going through the PACE program, once you have gone through that initial piece and they have certified you to be able to teach initially, you get full teacher pay. And I know now you can never pay a teacher enough, because teachers are worth millions of dollars, just let me tell you. But when it comes down to Horry County, I think a starting teacher starts about a little over $40,000 a year. And I have nieces and friends who have kids who have graduated, and they get discouraged because when they're going into the workplace, even though they have a 4-year degree, people are trying to pay them $12, $10, $12 to go and do a professional job, when fast food is paying more than that. But the $40,000 is pretty competitive. One thing that I would tell somebody who's thinking about it is to actually sign up to be a sub. I would say sign up to be a sub. We are using Kelly Services for our subs, and the rate is decent. If you have a high school diploma and go through the process, it's $130 a day. If you have a college degree, it's $160 a day. If you have a teaching certificate, it's $175 a day to sub. But go and sub at the different levels to see what you may like. Because I teach high school, I taught high school, I taught middle school, and I can deal with probably upper elementary school kids, and I run a little after school program, so I do deal with them some, but I don't know that I could go into an elementary classroom and be as successful as I could in a middle or high school classroom. So go and experience the different levels, and you might be surprised that education could be something that you're interested in.
That's awesome.
You sure you're not in the human resources?
No. No, but I will tell you this though. I know many people who went to college to become a teacher and got discouraged because they could not pass the praxis test. The praxis test is a test that you have to pass to teach. Right. Anybody who's out there who did not get past those initial praxis tests or need some study skills or would like for adult education to help them try to prepare for those tests, we are willing and able to work with students who already have a college degree but just having a difficult time getting past that test. You went to school, you probably got test anxiety at this point because you weren't successful on it, but we'll help you look at your test scores, look at the areas where you need the most assistance, and actually assist you to prepare for that test. So don't think that you got to go at it alone. In our buildings, we are equipped with the new Promethean boards that they use in the regular schools. So definitely come check us out, because we'll be willing to work with you to get ready for that test, and even let you play with some of the new technology so that you won't be so unfamiliar with what's being used in the classrooms.
Okay.
Absolutely.
Well, I think it's great that they have a lot of alternatives for people who are interested to kind of fast track into teaching. And, who's to say that, once a person enters even through a fast track, that they won't, be ignited to do more and then maybe go back to school and, even get a master's in a special area or work towards their doctorates or whatever. So, it is great that those offerings are in place. And so hopefully, that will kind of curb the teacher shortage a little bit. And it sounds like Horry County Schools has done a lot to, like you said, make recruitment competitive. And that's extremely important anywhere you go, and hopefully that's a model that everybody across the country will follow in terms of school systems. So is there anything else you'd like for people to know who are interested in education? And, anything you can say to put parents' minds at ease about the teacher shortage, especially if they're thinking, how is that going to impact my child's learning or my young adult's learning?
Well, what I would say is this, that, your leadership in the school, they are doing everything possible to make sure that they give supports to new teachers coming in and teachers who are coming in through the alternative certification programs. Horry County is probably one of the most forward-thinking as far as preparation for instruction in the class. It's all about consistency. So teachers don't go into the classroom and you have to figure it all out yourself. There are loads of resources, loads of pacing guides and things of that nature that help keep teachers on pace. And then you also have those supports within the school. Most of the schools operate in a team kind of setting where you're not planning alone, you're planning with your team. So that helps with that helps with keeping teachers in the profession. and teachers are given mentors when they first come in. So I would say that, listen, if you're thinking about it, I know many people who this is their second career and they love it. They love everything about it. And I even know teachers who started off they came to Horry County through the PACE program, and they now sit in leadership as principals and principals in our schools. So it's a testament to what can happen. Listen, we need you. We need our community because everybody talks about the schools, but listen, come on. And if you think you have a passion, if you got something to offer, come join our team. Hey, we would love to have you.
Well, that's a commercial right there.
That's a commercial.
I'm trying to tell you. Well, you can't have to worry about it. Etta just put it out there. That's the whole commercial.
Yeah,
Horry County. Hey, come see me if you need some help. Hey, I'll be glad to connect you with the right people.
Horry County just got some free advertising, I tell you.
Just like that. Just like that.
Just because we had Etta Greene Carter on the program.
Yeah. Endless possibilities in Horry County.
Oh, she even hit the tagline. Go ahead. Go ahead. That is awesome, Etta. That is awesome. And one thing I can say about Etta, though, she's definitely a pillar in the community and someone that the community loves and trusts. So I don't think she would steer you wrong. And I'm sure if you needed some guidance and mentoring, if you were thinking about becoming an educator, she would be the person that you want to connect with because she'll probably give it to you straight, no chaser, I'm sure. So
you either say yes, you will either say yes or no right there.
That's right. She's going to let you know what you're getting into. So, but anyway, thank you so much, Etta, for being here tonight. We really appreciate it. And listen, you put on some pretty long hours. Hopefully, you'll be going home soon.
Yes. Hey, listen, anybody who needs to learn English, come see us at Horry County Adult Education Program, either high school diploma, GED, or workplace development. Come see us.
Thank you, Ella. Have a good one. All right, good night. She's talking about all the programs that are offered at Horry County Adult Ed.
That's right, Adult Ed. There were some fabulous programs offered there, though. I mean, they have real good opportunities there.
Absolutely. Yeah. So, well, that was great information about education. And now, of course, we're going to pivot into community health. And we have you going to say something? And we have with us tonight Gina Waller of Care Team joining us to talk about the 30th anniversary of Care Team. Hi, Miss Gina.
Hi, Miss April. Hi, Edward. Thank you so much for having me on tonight. I appreciate it.
You're welcome.
Yeah,
Gina.
absolutely welcome. Yes.
After 30 years.
30 big years we're celebrating this year. We're very excited. We've been providing healthcare for 3 counties for 30 years now. It'd be Georgetown, Williamsburg, and Horry County. So we're very excited to celebrate this October, that big milestone.
Wow.
And I just wanted to talk about, some of the programs that we have here that we offer in all 3 counties. We do a lot. We do a lot for all of our patients in all different areas, no matter what their background is, no matter what their income level is, no matter if they're insured or uninsured. And we are still seeing thousands and thousands and thousands of community members not seeking healthcare until they end up at the emergency room. So that's been a hot topic for us, is preventative health. And I know I'm not going to pick on Ed, but men are our number one culprits at this. So of not seeing the doctor until they absolutely have to.
Unless they have to.
Yes. So a lot of things like stroke or your heart attacks can be prevented by, having different screenings. And a lot of that could be provided by your primary care physician. It could either be a doctor that you are seeing, a regular MD, or it could even be a nurse practitioner. And it's very important to make sure that you're being seen by your provider at least every 6 months, or annually. And some of those things that your provider is going to check for you are simple screenings, like they're going to check your A1C, which checks your glucose or your sugar levels. So that's going to check to see if you are possibly going to be diabetic or if you're pre-diabetic. And there's different medications and different practices that we can put in place to make sure that you don't become diabetic, or we can treat your type 2 diabetes. Another regular thing that happens when you go back to see your provider is that you get your blood pressure checked, right? Does anyone know why possibly we check your blood pressure?
Oh, to prevent strokes and stuff like that?
Absolutely, absolutely. So 9 out of 10 times as you age, sometimes your blood pressure starts creeping up there. There's many different reasons why. You could be the healthiest person in the world and run 5Ks on a daily basis, but your genes have a lot to do with your health, believe it or not. So sometimes you're just stuck with getting high blood pressure as you get older. So that's one of the screenings that we do as well. We also check your cholesterol. These screenings are very important because they're preventative towards things like stroke or heart attack. We also do blood panels. And blood panels can test for different ailments, chronic diseases that you may have. It could be possibly showing factors for an issue maybe that leans towards doing a cancer screening. But there's little indicators that your provider is going to watch for when you come in. So when I'm speaking to community members, the number one thing that they tell me is they say, Miss Waller, I just can't make it to the doctor. And as, a single mother of 3, I understand that. It's hard when you're working full time to get to your doctor. We understand at Care Team Plus that you don't want to take PTO, or you can't take PTO, or you have a sick child and you can't make it there at a certain time. So we're working really hard to have extended hours at our facility. For an example, on Wednesdays alone, we're open from 8 in the morning until 8 o'clock at night. We can make sure to see you and fit you in for your 6th visit. Or if you don't have any saved time and can't miss work, we can get you in after hours. Or even better yet, say you're at work, but you have a short 20, 30-minute break and you're an established patient with us. We can do like we're doing here, and we can do a virtual check-in with your doctor. So we have telehealth and telemedicine options where you can meet with your doctor and not miss an appointment and just be in the comfort of your office or your own home.
Whoa.
But that's a variety of services. You can really say you don't have an excuse. You're the excuse if you don't take advantage.
So transportation is typically a barrier or time. And then our biggest barrier, and we talk about it all the time, is income. We just talked about it with teachers, struggling with getting higher incomes. So at Care Team, something that we do that's very special is that we offer a sliding fee scale for those that are insured, underinsured, or uninsured. So you can apply for that sliding fee scale and be able to get a discounted rate if you follow the qualifications for not only your provider appointments, but also for our on-site lab and for our on-site pharmacy. And a lot of people are not aware that we have those 2 facilities within Care Team Plus as well. So we have a phenomenal pharmacy. I can't talk about it enough, where you don't even have to be a patient at Care Team Plus to use our pharmacy. And we have a lot of programs put in place to help you with your medication costs. So that's something that a lot of community members are not aware of. Another thing that we do at Care Team Plus is we offer an array of free services. I can't say this enough for our younger generation as well. Not only do we offer free reversible long-acting contraceptives, so that includes your IUDs, your birth control, your Nexplanon implants. We offer all of that covered. We also offer something called STI bundles. So those are sexually transmitted disease bundles. Anyone can come in at any time during our office hours, walk in and get a free STI test. So that is something we're just trying to spread the word about, because one of the biggest issues that we are seeing in our county right now, especially among our youth population, are these sexually transmitted diseases.
So
go ahead, Brother Eric.
But you mentioned I think you mentioned the school system, but is there any kind of partnership with the school system, because Etta came on and mentioned something about the shortages of teacher shortages.
Yes.
Could there be some kind of collaboration there to increase the incentives, for example, of teacher shortage by partnering with and providing a cheaper insurance, health insurance to them, which increases their pay really in a way.
Absolutely. So actually, we do have a partnership with teachers that are paid through the government, especially with Horry County Schools. That if you are a school teacher and you are on the Horry County Schools insurance plan, you actually do not have to pay a copay when you come to Care Team Plus. So that is one of our perks that we offer. We do work with Miss Etta quite a bit. Her students are amazing. Her teachers are amazing. We go to the Adult Education Center to do free testing for HIV and as well as for Hep C. We also work very closely with Conway, different schools in Conway, including CCU, as well as or Georgetown Technical College. So we're always in the school systems. We're very close by. Our main building is located right next to Conway Hospital off of Singleton Ridge Road. So we're accessible to everyone, to Carolina Forest, those that are in Conway. We're right off of 544 and 501, and we're very close to Georgetown County as well.
Yeah, absolutely. I should say this for last, but I think I should bring it up. You have your different screenings. I'm going to mention prostate, issue prostate. I know that's more closer with a specialty, probably with urologists, but I don't know if you have those on board or not.
So we only have a specialist for ID. So what that is infectious diseases currently. We are expanding our team. We're excited that we're bringing on a new pediatrician shortly, as well as a nurse practitioner that will see pediatrics. Our team is growing. We're going to be expanding very shortly towards the Polly's area. So we are adding more physicians, more providers, more nursing staff. We are hiring. We are going to enrich our community as much as possible. And it's important to us to bridge that gap with healthcare in our community.
Okay, and I didn't get that community that you're going into. What did you call it?
We're going to be expanding towards Polly's. We do have a site in Georgetown right now, but we're shortly going to be expanding. So that's something that's coming down the pipeline. We're expanding our providers that are at our current location off of Singleton Ridge Road. So very exciting things happening at Care Team Plus.
That certainly sounds like it. Yeah. So that was one of the reasons why I was enthused about like getting you on the program to start expanding on this program in an informational way to kind of let the community know some of the things that are available at such like attractive things that are at a reduced price a lot of times, and in essence you might want to say that you're not just a clinic, you're not on the street, see. And sometimes you're mistaken for that though. When you're not, when you don't sound like a medical, say like Conway Medical Center or something, or a hospital, and you say that this is a clinic on by the road or something like that. That's the word that's on, on street talk there.
We are a healthcare center, so
Right.
we have everything under one roof, and we're really here for everyone, no matter, like I said, what your background is, no matter if you're an infant to you're 99 or older, we really serve everyone. And through that, we do family care. So you can come to the office with your entire family. I know personally, I'm seen at Care Team because I love our providers. My mother sees the providers and my children see the providers.
Right.
And it's wonderful that I can literally bring in my sick child. She can get diagnosed with an ear infection, which is common, common for my little one. And by the time we're done seeing the doctor, her script is ready and we're ready to go. I don't have to make another trip to go to a pharmacy farther away, wait in line. It's a fast system. It's convenience. And that's something that I personally love. I personally love for my family. I know we try to make it as convenient as possible for our rest of our community members, and we're trying to raise the bar in healthcare. I know we've all been through quite a lot with COVID. COVID is still around. We're still battling COVID. I've been in the public health field for over 16 years, and I've never seen anything like what I've seen with COVID. But we're making adjustments, and we're finding the new way of life through COVID.
Okay, did you all reach any challenges in dealing with what used to be called, it was called Obamacare, but affordable health care? Well, did that present any challenges in the state of South Carolina, then reach down to Horry County?
It did, because a lot of people didn't realize that we had resources for them. So trying to get the word out about that too is really important, Edward, and I'm glad that you brought that up. Being a FQHC, which is a federally qualified healthcare center lookalike, we also offer free benefits enrollment. So we have a benefits navigator. You can call, make an appointment at any time, or stop in to see her. We have our own tier for it at our office. And she sits down with you and goes through, especially with open enrollment times, to find out what insurance plan would suit you best. And that's really important to know, because you can go to all different insurance places, and they're going to want to sell their insurance plan, which all of us want to sell our brand, and I understand that. But it's very important to pick out an insurance that's going to, make sure to reach your medical needs. And we have to go through what your medications are, what your health needs are, what's your specialist, make sure that they take your health insurance. Because the last thing we want to do is make sure that, we sign you up for a health insurance plan, and then you find out that your favorite specialist doesn't take your plan. Then you have to start all over again. We don't want you to have to go through that. So we find who's going to fit your needs, and then also your financial needs too. And a lot of our patients that come to see us, you don't have to be a patient. You can just be a plain Joe Schmo off the street. You can come on in. We welcome everybody for this benefit. We make sure that you can financially afford it too. Some of our clients pay nothing. They pay nothing. Some patients, pay a certain fee, or they can pay up to, $50 a month, or all the different price ranges. We go over that with you. So we have to make sure that it's tailored per your medical needs, and B, per your finances. You need to make sure that you can be able to afford this plan. I don't want to, give you a high deductible plan and then you can't afford to pay your deductibles. So we work with you on that as well.
Okay. No surgeries occur. You don't do surgeries, right? I mean, it's just unless it's very, very minor, on your arm or something. Yeah.
No, we work very closely with our local hospital systems. We have a great relationship with Conway Medical Center, Tylands Health, McLeod. They have been wonderful towards us and really helping us grow. So we do work very closely with their specialists, and we make sure to send our patients to the right specialist and who they need and who they feel comfortable with. And location is a very important thing too. We want to make sure to give them their options of who we can refer them to, and we make that connection. And our providers stay in connection with the specialist or the patient as well.
Now, did I see a huge bus that had mammogram on it? Was that?
Absolutely. So that was Conway Medical Center's mammography bus. Right. So they come to Care Team Plus every 3 months. And what we do is we do free or low cost mammograms and pap smears. So we work with a couple different grant processes, mostly Best Chance Network, to provide community members that are over the age of 40 free mammograms or reduced prices for that.
Okay, so when you say reduced, is someone eligible? Is there anybody that's eligible to have a no cost mammogram? The
majority of those that come to us are able to enroll into BCN. The only ones that typically pay low cost is someone that already has insurance and doesn't qualify for BCN. So then they just pay the deductible, but there is a plan that we can work with you and Conway Medical Center to see if you qualify for any other different grant program. Like there was a Duke Endowment program as well, and there's always different grants that are coming through. So we just work with the staff very closely with each patient to see what exactly they qualify for, and if the person is in need and meets the requirements, especially with their house size, their income, we try to make sure that we get that covered for them.
So
We don't turn anyone away.
Well, that's good to hear. That's decent, really good to hear. So what kind of recommendations, I know you're in the marketing department, not a doctor, but
That's okay.
what kind of recommendations do you make for people to have mammograms and other tests for preventive measurements? And what how frequent do you recommend? For example, a mammogram every 6 months or something, or every year, or what?
A mammogram is you have to be over the age of 40, and it's once a year that a mammogram is covered. Yes. The only thing that we cannot do on the bus is that we can't do a diagnostic mammogram. So what that means is if you came to us and you were having some symptoms like you were having a lump or you were having discharge or redness, they would actually have to bring you in to their office to do a diagnostic exam, which is not done at our center.
Okay. Well, April, what do you think?
I think this is excellent information, and congratulations on the 30th anniversary. You all are obviously doing great things in the community, and we just hope that you continue to find ways to provide these types of services to everyone, because like you said, preventive care, that's where it all begins. And if everyone is aware of what you have to offer, then hopefully they'll take advantage of these services and, to just, make sure that their health and well-being is in tip-top condition. And so if anyone wants more information, is there a website that they can visit?
Yes, so our main website is www.careteamplus.org. We also are very present on our Facebook page at Care Team Plus, and as well as we also have a TikTok page and Instagram.
Okay. That's awesome.
Our providers actually love TikTok, but I'm hoping that our providers will come on with you guys soon and talk about some other topics and other things that you wouldn't expect to be able to find at a healthcare center.
Yeah.
Well, I think, Ms. Gina, since you're the director of marketing, you need to just go ahead and set it up. Let us know when you want to be on when they want to be on the air.
Yeah. That sounds wonderful. Thank you both.
Yeah, absolutely.
So that's all you need to do.
That is it. Well, Brother Errol, I tell you, we've had a great night of great information about education and community health care, two very critical topics that we're always focused on. And we just want to thank Ms. Gina Waller for being here and doing the amazing things that she and her team are doing at Care Team.
It's good working with her.
Yeah, and it's also great to see Etta Greene Carter anytime. So I think we've done our due diligence tonight, besides reminding everybody that there is a tropical storm / hurricane, Idalia, knocking on the coastline. So everybody just needs to be extra careful. I understand that Horry County schools are closed or will be closing, tomorrow or whatever, and they're going into their Thursday, going into their e-schools. And so I think recently, just maybe about an hour or so ago, the governor issued a state of emergency. So now don't all, flock to the grocery stores to get all the bread and
save somebody some
peanut butter and all that. Blow your budgets.
Yeah.
But, just at least have some batteries for your flashlights and, get one extra loaf. You don't need 10.
Right.
It's not going to, I don't think it's going to be that kind of situation, but we never know. We don't predict the weather.
Look,
we can't control it.
You'll always have Care Team over there to
Hey,
got your
on
back.
standby. That's right. On standby. But all in all, we just really want everyone to be safe.
Yeah.
Be safe. Yeah.
Absolutely.
Yeah, absolutely. So, well, Brother Edward, this has been great. I really enjoyed the show tonight and our special guests. And so, we're going to keep pushing. We'll be back next Tuesday night, same time, 7 p.m., with some more great information for the community.
For the community.
Mm-hmm. Yeah, we'll do that.
So Gina, thank you so much.
Yes.
Well, appreciate it. Have a great night. Stay safe.
Welcome.
You and the big care team over there.
Yes, have a great night, everybody.
Okay.
All right.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.